Hi guys, it's Dr. Deeds here. I'm just making this quick video to introduce you to all of the FDA-approved medications for treating obesity and for weight that I use for weight management in my clinic. There's more than just injectable medications, so we're going to talk about what are some of the pill-based medications that you should know about because these can be really great and affordable options for you. So without further ado, let's dive in and start with our first medication. It's a single agent pill called Phentermine. We've been using it for decades. It's been around forever, one of the older medications, and it really works. It's really quite effective. Now, this medication, it is a cousin of Adderall or stimulating drug. So therefore, some of the side effects are that it can cause some anxiety or elevated heart rate, maybe some trouble sleeping. Occasionally patients will have some dryness with this. They don't usually get the positive benefit of any like hyper focus or help with that, but some of those are the negative side effects. But generally, I find most people tolerate it really well, but certain people, we have to stop it because of those side effects. It's also, we can't use it in people who are pregnant or have glaucoma, or if you have maybe really uncontrolled cardiovascular disease or high blood pressure that's not well controlled. Now, the good news about Phentermine is it works and it's very inexpensive. We're talking tens of dollars without any insurance coverage. And on average, people get about 6% of weight loss, which is 6% from their baseline weight loss, which is really quite good. It's enough to see improvements in things like sleep apnea, blood pressure, cholesterol, diabetes, or prediabetes. So even though 6% may not be your goal, it is a good first step. And I've had many patients who do much better or reach have much more sustained and longer weight loss. We can also cycle on and off this medication or use it for longer term. And I find that when we do that, we can reach a more acceptable target weight with that. Okay, so that's good. That's probably the cheapest and a nice single agent drug. Next, we have a combination pill called Qsymia. It includes that same medication, Phentermine, as well as a second medication called topiramate. So this works on the norepinephrine pathways. Topiramate is classically a medication that we might use for migraines, seizure disorder, and some mood disorders. And we've always known when people were on it that they lost weight, and it seemed to suppress their appetite, maybe change some of their taste receptors. So this medication in combination can work really well and be really quite effective, up to 12% weight loss at 12 months, which is pretty close or comparable to some of our injectable medications like Semaglutide or Ozempic. And so it works, it's really effective. And the topiramate does have some side effects that you should know about, and often when we see those, we have to stop it. But the main side effects for that are some numbness or tingling in the fingers or toes. It's reversible, so if you do get that and we pull the medication off, the sensation will go away and regular feeling will come back. Usually my patients are kind of bummed because it does seem like for people it's working tend to sometimes have that side effect. And then the other side effect to know about is sort of just like a little bit lightheaded, not really lightheaded, but maybe not thinking as clearly, feeling a little bit off. It's very vague, but if that happens, we can stop the medicine and just see if perhaps it was a side effect from that medication. Otherwise, again, it's pretty well tolerated. When you're taking the combination prescription pill from the drug company, the cost is about $150 up to $200 a month, or we can prescribe those medications separately, right? Phentermine comes as its own medicine, topiramate as its own medicine, and then we're looking at, again, tens of dollars, less than $50. The caveat is that the dosing is not quite right. It's not exactly the same as when we have the combination pill. So we just make some adjustments when we're doing the split dosing. But it is still for most people an affordable option. Okay, now our third option is a medication called Contrave. It is also a combination medication. It has two drug ingredients, bupropion and naltrexone. This works on dopamine receptors and opioid antagonists, and together it's been shown to be quite effective for weight. Particularly, we see that this could be a good option for people who also have some depression or mood disorder, and it can also be a really good option for people who are trying to quit smoking or quit tobacco or have some tendency to overuse alcohol or alcohol use disorder. This medication can work really well in those cases. Now, some of the side effects include some dry mouth, some nausea, some stomach upset. Bupropion can, for some people, make it hard to sleep or worsen depression, but that's pretty rare, but it's like a paradoxical effect of the bupropion. Some contraindications for this one would be if, again, really uncontrolled blood pressure that's not managed, seizure disorders, or if you're on an opioid or chronic pain medication, you would not be a candidate for this medication. Now, in combination, the brand name drug is about $500 a month. The company does have a coupon that brings where you can order it directly from them, and it brings the cost closer to $100. It's a pretty big discount. Or because it's two different pills, we can prescribe them separately as two independent pills. Then we're looking at tens of dollars, or a pretty affordable price point for this as well. But we run into that same issue where when we split it up, the dosing is not quite the same as what it would be in the combination pill. Now, Contrave can work really well, like I said, for certain people, especially if we're also trying to treat a secondary condition, or we've tried other ones and there's been side effects and they haven't worked. This could be a good option. It is a bit more modest in its weight loss. It's less than 10%, generally around 6% on average. So that is just something to know that, again, is still enough to really make a health impact, but may not be as impactful as some of our other medication options. Okay, so moving on, we can talk about the next era of medications, or the new era of injectable medications. Now, these have just really been a game changer for patients, but there's pros and cons with everything. Major ones being kind of cost and side effect here. So we'll talk about the two big players on the market, and just know there are more going to be coming down the line in the coming years. Okay, so first up we have Ozempic, or what most people know as Ozempic. It's the medication is called Semaglutide, and this is a GLP-1 agonist. GLP is a receptor that's in the gut lining. We know that this plays a role in kind of our gut-brain axis that controls hunger. It slows down digestion, so that's where there's a lot of side effects can come in. And it's also an insulin mimicking medication, and so it helps greatly for people with diabetes who have trouble controlling their blood sugar because of its role in that pathway, in the insulin pathway. So some of the common side effects, the most common ones, are just nausea and constipation, really the most common. It can worsen acid reflux. Now, I find that those symptoms are definitely worse depending on diet, or like diet dependent. So if you're eating really healthy, kind of leaner meals, or you've split up your meals to be smaller portions, and you're going to say, instead of having a big lunch, I'm going to have two small lunches, and spread it out that way, you tend to have less side effects. But let's say you're going out for pizza or a burger, and you eat it pretty quickly, and you've had like the whole piece or a whole burger, and then you might pay for it later with some upset stomach, and it can be really miserable. But it doesn't mean you can't have those things. It just means start with a few bites and then just wait to see how it goes. And really, it kind of tends to be the more fatty, greasy, fried foods that seem to be the worst for those side effects. We can treat through all of those things. We can treat nausea, we can treat acid reflux, we can treat constipation. So it's not a reason not to go on it. The only, unless it's a severe case, occasionally patients will get the opposite, and they'll get diarrhea after their dose. We can also treat through that. Sometimes it's just too bad of diarrhea constipation cycle, and patients kind of want to call it quits or try something else. But those are kind of the major side effects, and most people do fine on it. So the big benefit really is for that blood sugar control, and for diabetics, they work really great. It gets a good amount of weight loss, 15% on average at the end of a year, which is just remarkable for health, and as well as helping people feel better and feel good in their bodies again. Some of the contraindications are a certain rare endocrine tumor called MEN2. So that would be like if someone's had thyroid cancer, as well as other cancers of different glands in their bodies, or a family history of that. We consider that a contraindication. It's not all thyroid cancers, so really this is something we individualize So a history of thyroid cancer doesn't mean you're not a candidate. It's the specific type of cancer that matters. And that was found in rat studies. It has not been replicated in human studies. And we've been using this type of medications for diabetes for 20 years. So pretty good safety evidence there. Now, if you have a history of pancreatitis and gallstones, they're not true contraindications, but they might be something that we're going to be watching really carefully while you're on the medicine. And of course, I didn't mention this for all of these medications cannot be used in pregnancy or if you're trying to get pregnant. So the major downsides here is just cost, and most insurances do not cover this medication or any of these medications. The out-of-pocket cost is about $1,000 a month just from the pharmacy, $900 to $1,000. Most people don't qualify for a coupon, but some people do, and it brings the cost down to maybe $500-$600. Now, the company that makes Semaglutide has started a direct-to-patient program, and so you can get this medication, all of the doses, and in a pen form for $500 a month directly from the pharmaceutical company, which is really going to be a game changer. And that just started in February, March of this year, 2025, when I'm recording this. Okay, so that's a great option for people. Now, my favorite drug, my favorite medication to use because of its really its outstanding efficacy for weight, but also because it has a lower side effect profile and is more well tolerated, is Tirzepatide, which is also known as Zepbound. And Tirzepatide targets that same target as Semaglutide, so a GLP, it's a gut receptor. And it also is an agonist for a second gut receptor called GIP. Okay, so it's got two different targets, similar effect, slowing down digestion, the fullness signals, also helping with controlling blood sugar through the insulin pathway, so great for diabetes. And on average at 12 months, people are getting 20% weight loss, and like some people really blow it out of the park and are getting 30% weight loss if that's what their body needs, or they can get a much more significant amount. And some people it's a little bit more modest, but 20% is about on average, which is just outstanding, our best medication. It has the same side effects as Semaglutide, and the constipation, acid reflux, nausea, similar, usually diet dependent makes it worse. I've also seen that like when people maybe are drinking alcohol, some of them times the nausea is worse related with that as well. And then the similar contraindications regarding the cancers, pregnancy, and just being watchful of pancreatitis and gallbladder issues. The price is about the same as Semaglutide, so Tirzepatide costs about $1,000, $900 to $1,000. They have had a direct line selling to patients from the pharmaceutical company for several months, actually, probably about 6 months at this point, but they only had their two lowest doses. And just also in March, they started to have some of their higher doses available as well. And so the pricing may not be updated after I record this video, but they lowered it. So the intro doses, the price is, I believe, $350 and $400 or $450 a month. And then it's $600 a month for the higher dose vials. I did hear that if you don't fill the vial every 4 months, they might increase the price. I don't know the specific or details of that, but just as a way to avoid people from buying the high dose but then only giving themselves a little bit. But quite frankly, if that's all you need, it may still be a cost savings method that we can try. So there you have it. I just went through like a ton. It's a big whirlwind. I didn't give you any visuals. So if you've listened to all of this, you now have a good overview of the options. In the pipeline, we have some new things coming that are in phase 3 trials. That means they're in their last leg of human trials and they'll be waiting FDA approval. I expect some of these to come out in 2026. And so stay tuned for some more things. And I think as we get more treatment options, the prices will still continue to come down. And perhaps as the prices come down, insurance will just start to recognize that this is really a condition that deserves treatment so that we can prevent people from getting sick, which is always kind of what I'm here to do. So if you have questions, of course, feel free to reach out for me. I hope you found this video helpful. And if you're working with me and one of my patients and you want to get started here or talk about any of these, or we're trialing through the different options, yeah, we'll just make a visit and be in touch. Have a good day. Bye.